Good afternoon. My name is Michaela Etheridge. I'm a student nurse at the University of South Alabama's College of Nursing, and this is my NG tube positioning video. So the first thing I'm going to do is verify my order, and I'm going to be verifying my enema procedure and my NG tube procedure in this same video. So we have insert Salem sump and connect to low intermittent wall suctioning and soap suds enema on arrival of the floor. And I would check my hospital policy for those. Then I would perform hand hygiene and identify my patient using two identifiers. So we have Jaguar Jones, MR number 4176352. MR number 4176352. And then I would also check my allergies while I'm here. So the chart says allergies penicillin, and the patient's wristband says allergies penicillin. Then I'm going to explain the procedure to my patient to alleviate any anxiety, and I would close a door or a curtain to provide privacy so the patient feels comfortable. Then I'm going to gather all of my equipment, which I have already done. So I have it all set out and ready. I'm going to don my goggles, and I have my stethoscope and pen light ready for use. Then I'm going to perform hand hygiene. I'm going to raise my bed to a working height and lower the side rail, and I'm going to assess my patient's vital signs. So I'm going to also assess their oxygen saturation and auscultate their bowel sounds with my stethoscope. And if I had a decrease in their oxygen saturation or deterioration in their vital signs, I would stop the procedure. Then I'm going to place them in a high phalange position unless it is contradicted, and I'm going to establish a queuing sign with the patient. So if they need me to stop or want me to stop or are in stress, they're just going to put a thumbs down for me and I'll know to stop. Then I'm going to open up my package, and I'm going to lubricate a dollop of lubricant on the inside of the package where it is clean. I'm going to prepare my tape. So I have my tape prepared already for use for labeling, measuring, and keeping the tube in place. Then I'm going to get my 60 milliliter syringe, which I do not have, but if I did have it, I would loosen the plunger by going in and out until it was ready for use. Then I would perform hand hygiene and put on my clean gloves. And I would assess which nair I'm going to use. So I would just occlude one nostril and then get them to breathe in or out, just breathe normally, and do that alternately on both sides, and assess which one is most patent. And whichever one is, I would choose. So I've chosen the right side because it's closest to me and it's the most patent. Then I would get an alcohol swab or soap and water, and I would clean the bridge of the nose and then pat it dry. Then I'm going to measure what I need, but I've already measured in a different video, so I'm just going to get my dog-eared tape and place it where I need it on the syringe, and that will measure how far in I'm going to need to go. And I have it dog-eared for easy removal. Then I'm going to place a towel over my patient's chest. And I'm going to get a basin to put over on their abdomen to put the end of my tube in and to catch any possible emesis. Then I'm going to get my tube, and I'm going to coil the end around my hand and then release. And I'm going to lubricate the first 4 inches with the lube that I have placed on my package. And I can begin. So I'm going to insert into my patient's nair with the curved end pointing downward. And I'm going to get my patient to extend their head backwards on the pillow before I insert. And I'm going to just push it in until I reach the nasopharynx area. And I'm going to get my patient to swallow or take a sip of their water. and I'm going to get them to relax once I reach past the nasopharynx and put their head forward. And I'm going to insert 1 to 2 inches at a time, turning 180 degrees each time I go in until I reach my marker. And I would make sure not to push against any resistance when I'm going in. And if my patient had a decrease in oxygen saturation, started coughing, or showed any other signs of respiratory distress, I would stop the procedure until they started breathing normally again or calm down. And then I would just get them to swallow before I put it back in again. Then I'm going to secure this on the patient's cheek with my tape. And then I would check the position with my, in the correct position with my pen light and my tongue blade. So I would just look in the patient's mouth and into their throat and make sure that's in the right spot. Then I would connect my 60 milliliter syringe. And to check for correct placement, I'm going to aspirate their gastric contents. I'm going to assess their pH if indicated, and I would get a chest x-ray if that was ordered to see if that was correct. Then I would remove my temporary tape, and I would get my tape to make it floating, and I would attach it to their nose, and I would get a skin prep pad and just wipe the nose and place the tape on and place it on the tube to make sure it's floating. And then I would get the tube and clip it to the patient's gown so that they can have enough room to move their head as according to hospital policy. And I would mark where it's in to see any movement or displacement when I come back to check with an indelible marker. And then I'm going to show you how to suction, use the low wall intermittent suctioning, if that is what was ordered. So I'm going to get the suction, and I'm going to place it, connect the tubes, and I'm going to turn on the low wall intermittent suctioning and make sure that the blue pigtail is above the patient's stomach, and I would have it like this. And if I was not using suctioning, I would still have the blue pigtail above the patient's stomach, but I would just close like this and leave it above the patient's stomach. So I have finished that. So then I'm going to lower the head of the bed to no less than 30 degrees. I'm going to assess my patient's comfort. I'm going to raise my side rail and make sure that the call light is in reach. And I'm going to lower the bed back down all the way to the lowest position and just make sure that my patient is comfortable. Then I'm going to clean up my supplies, and I'm going to remove the towel, clean up my supplies, and I'm going to take off my gloves and perform hand hygiene. Then I'm going to go and document. So I'm going to document the size and the type of NG tube. I'm going to document the time that it was given. I'm going to document whether I put it in the right or the left nair. I'm going to document how I assessed for the correct placement and position. I'm going to document how I placed the tube, how I kept it secured. I'm going to document the amount, color, and characteristics of the secretions, and how the patient tolerated the procedure. And I'm going to now show you how to remove the NG tube. So I'm going to go back into the room and verify that I should remove the tube, and I'm going to explain the procedure to the patient. I'm going to perform hand hygiene, and I'm going to put on another pair of clean gloves. And then I would auscultate my patient's bowel sounds. I'm going to turn off the low wall intermittent suctioning. I'm going to remove the tape, and I'm going to unclip it from the patient's gown. And I'm going to get my patient to hold their breath. I'm going to kink the tube, and I'm going to pull it out steadily and smoothly and put it aside. Then I'm going to be done with removing it, and I'm going to assess the amount of secretions. I'm going to perform oral hygiene on my patient, and then document that I have removed the tube.